of a sudden she invited me over, and I was like, "Hey guys, has you ever talked about sex in a conversation at school? What's going on, guys? It's your boy, and today we're gonna be talking about sex and its components. It is important for us to teach this because everybody needs to know how to keep themselves healthy and safe from STDs and other things."
Chlamydia is a common sexually transmitted disease. It is caused by a bacteria called Chlamydia trachomatis. It can affect both men and women. You can get chlamydia during oral, vaginal, or anal sex with someone who has the infection. A woman can also pass chlamydia to her baby during childbirth. Antibiotics will cure this infection. You may get a one-time dose of the antibiotics, or you may need to take medicine every day for 7 days. Antibiotics cannot repair any permanent damage that the disease has caused. It is common to get a repeat infection, so you should get tested again about 3 months after treatment. Symptoms in women include a burning sensation when urinating and pain during intercourse. But symptoms in men include burning or itching around the opening of their penis and pain and swelling in one or both testicles.
Gonorrhea is an infection caused by a sexually transmitted bacterium that can infect both males and females. You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. Gonorrhea can be cured with the right treatment, such as dual therapy or using 2 drugs. Most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild. Some men with gonorrhea have no symptoms at all. However, men who do have symptoms may have a burning sensation while urinating or a white, yellow, or green discharge from the penis. Today we're going to be talking about why it's important for everyone to learn about their reproductive system and the reproductive system of the opposite gender.
To show you the importance, first we're going to explain both systems and how they work. The female reproductive system is made of the ovaries, uterus, fallopian tube, cervix, endometrium, and vagina.
The ovaries are located in the lower abdomen and are the parts of the female reproductive system that produce eggs.
The cervix is a covering that protects the uterus and the potential baby from the vagina.
Once an egg is produced, it travels down the fallopian tube into the uterus.
While the egg is traveling down the fallopian tube, the lining of the uterus is building up and becoming rich in nutrients in preparation for the egg. This is called the endometrium.
This is also the time when the egg is able to be fertilized. When the egg reaches the uterus, it begins to grow if fertilized.
Monty, next we're going to be talking about the male reproductive system.
The male reproductive system consists of the testes, scrotum, vas deferens, epididymis, ejaculatory duct, prostate, urethra, and the penis.
The testes are the sperm producers. The testes are packed with sperm-producing tubules and cells that secrete testosterone. The testes also hold the seminiferous tubules, where sperm matures.
The scrotum is the sac that holds and protects the testes. Since the testes must remain at 95 degrees, there are muscles in the scrotum that brings the testes closer to the body if they are too cold, or lowers them farther to prevent them from being too hot.
Sperm is produced in the testes. It then matures as it travels down the epididymis.
Once the sperm has matured, it is then traveled up the vas deferens when semen is mixed, and then into the ejaculatory duct where the prostate fluid mixes into it.
Upon ejaculation, sperm travels through the urethra into the outside.
Hey guys, it's me again, and I'm here to talk to you about sex. Sex, also known as sexual intercourse, procreation, or lovemaking, is also the primary method of reproduction for us, humans. Though most people hear of it as this amazing feeling that must be experienced, it actually may carry dangerous diseases. It is crucial that we perform it in a safe way so that we can remain safe. That's why we should stay, come on class, abstinence.
Intercourse is sexual contact between individuals involving penetration, the insertion of a man's erect penis into a woman's vagina, typically culminating an orgasm and the ejaculation of semen.
Fertilization is the action or process of fertilizing an egg, involving the fusion of a male and female gametes to form a zygote. In humans, implantation is the stage of pregnancy at which the embryo adheres to the wall of the uterus. The stage of the menstrual cycle is menstruation. This is the time of bleeding or the period. The inner lining of the uterus, the endometrium, flows out of the body through the vagina. Periods usually last between 3 to 7 days. About 4 tablespoons of fluid leaves the uterus during a period. The first day of a woman's period is considered day 1 of her menstrual cycle.
Second stage of the menstrual cycle begins when the period is over. As the egg matures, the lining of the uterus gets thicker. This takes about 6 to 12 days.
The third stage of the menstrual cycle is called ovulation. This is the midpoint of the menstrual cycle. Hormones cause the chamber around the egg, called the follicle, to break open and release the mature egg into the fallopian tube. This is called ovulation. Now the woman can become pregnant. Ovulation usually occurs on day 14 of a woman's menstrual cycle. Some women experience slight discomfort, such as cramps during ovulation.
The fourth stage in the menstrual cycle is when the egg travels to the uterus. This is the most stable part of the menstrual cycle. It lasts for about 14 days for most women. During this stage, the uterus is ready to receive a fertilized egg. The egg usually takes 3 to 4 days to reach the uterus. If the egg has been fertilized by a sperm cell, it attaches to the thick, blood-filled lining of the uterus. This is the start of pregnancy. If an egg is not fertilized, the egg and the lining of the uterus breaks down. The extra blood and tissue of the uterus begins to pass out of her body through the vagina, and the woman begins her period.
A reminder that the only way to stay safe is to be abstinent. The 2 ways, if you're not abstinent, to stay safe during sex is by using birth control pills and condoms. Thank y'all so much for watching. And don't forget to like, subscribe, and if you were to remember one thing only from this video, no sex is the best sex. Thank you guys.